Are you suffering from persistent foot pain that's not responding to any treatments? Then this video is for you. I'm Dr. Karen Drummond, owner of Drummond Chiropractic, and I'm going to be sharing with you the top 5 things you should know about your foot so you can discover the right kind of treatment that's going to work for your specific condition. And as always, before you follow any advice from any video, check with your healthcare provider to make sure it's appropriate for your specific condition, and hopefully that's one of us here at Drummond Chiropractic. So let's get on to those 5 things you should know, and plus I'll add a bonus one at the end. The first thing is my biggest pet peeve, is when patients come in with foot pain and they're diagnosed with plantar fasciitis, and they don't have plantar fasciitis. You can't be treating your foot with treatments for plantar fasciitis if that's not your condition. So the way to know if it's not plantar fasciitis is if your pain worsens as you walk, it could be. But if your pain improves with walking, then it is not plantar fasciitis. You need to look at other conditions that can mimic plantar fasciitis. One of these conditions is tendinitis of a muscle in your calf or in your foot, like the posterior tibial muscle or even the flexor hallucis muscle. Those tendons go into the medial part of your foot, and if they're inflamed, they can cause pain that mimics plantar fasciitis. Other things that can mimic plantar fasciitis are things like arthritis and bursitis of the joints in the ankle. These pains can refer into the plantar fascia area. If your pain's on the top of the foot or the lateral side of the foot, it's probably not plantar fasciitis. So things that can cause those kind of pains are things like Morton's neuroma, also called Morton's toe, and this is where the nerve sheet itself is inflamed. Things that can cause this are shoes that are too tight or some sort of trauma. So I've talked about the itises like the plantar fasciitis, but things that can mimic it like the bursitis or the tendinitis is things like arthritis. That's my number 2. That's when the problem is in the joint itself. And when it comes to arthritis, don't think of your bones as iron rusting with time. Bones are living tissue. So if you keep giving it the stressors that cause the arthritis is going to continue. But it doesn't have to be this way. If you take the stressors away, then the bones can remodel, and I've literally seen arthritis reverse. It takes time, just like it takes time for arthritis to develop, it takes time for the body to remodel it, for it to go away. So to help your arthritis, you can help it physically by providing proper supports for your feet. You can also help it nutritionally. Like one of the arthritis processes that can cause foot pain are things like gout. And when it comes to gout, that is a form of arthritis that absolutely can be helped with diet, and also with supplements like being cherry juice. And with other arthritic processes like bunions, wearing night splints at night. I have a whole list of remedies for different kinds of arthritic processes in your foot. Check it out on my website. So for number 3, if you have any numbness, tingling, or weakness in your feet, know you have to look beyond your feet. This could be a sign of a serious disease that's damaging your nerves. So look for things like diabetes, hypothyroidism. Also, it could be that your nerves are getting pinched in other places of your body. It could be coming from a pinched nerve in your back, or in your knee, or in your lateral leg, or in your foot itself. So make sure that when you have foot pain that the doctor is looking beyond your feet. And did you know in your foot you have a tunnel just like you do in your wrist? In your wrist, it's called your carpal tunnel. I'm sure you've heard of that. But did you know you have a tarsal tunnel as well? So when the tarsal tunnel is not open, that can pinch that nerve and causing terrible foot pain that can mimic plantar fasciitis, or it can also cause numbness, tingling, or weakness. So make sure that you're checking your ankle. And what's cool about tarsal tunnel syndrome is oftentimes you get your ankle adjusted and you get instant relief. So that's why I'm kind of partial to chiropractic. If you have foot pain, see a chiropractor. And number 4 is really common and often overlooked, and that is your lymph system. Your feet are the lowest part of your body, so the lymph can pool down there. And remember, lymph is carrying all the metabolic waste like lactic acid. It's literally acid. And so when you first step on it, can you see how that would cause a burning pain? So if when you first get up in the morning and you have burning pain in your heels or your bottoms of your feet, it could be lymph. And as you walk, you're milking it out so you feel better with walking. So again, I can't stress enough. If you feel better with walking, then it is not plantar fasciitis, and it most likely is lymph. And number 5, surprisingly, it could be literally you have fractures in your feet. I can't tell you how many times I have patients coming in and they've had Graston and manipulations and stretching and strengthening, and their feet just aren't getting better. Well, they had an x-ray and it said it was negative for fracture, but they had micro fractures. If you've tried everything and your feet are still stubbornly in pain, then you may need to wear a boot for a couple weeks. And if it is a stress fracture, try symptom officinalis. It's a homeopathic remedy that is really amazing. It helps the bone stitch right up a lot faster. So my bonus one is if you're a child or an adolescent and you have stubborn foot pain, make sure they've looked for tarsal coalition. It's pretty rare, but if you have it, it can cause foot pain. It's when the bones of the ankle grew a little funny or they fused, causing an aberrant movement of the bones and stresses the muscles and tendons out. So an x-ray will reveal if you have this, and if you do, then it may be that you need some surgery. So I hope this has been helpful, and if it has, please let us know. Comment below. You know we love hearing from you. And until next time, stay well.